We understand that it has been disruptive for some people, and we're working hard to ensure that it is more streamlined. So just bear with us. We will get through it. So with that, I'll open it up I'll pass it over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us in person. Since the media advisory yesterday, we have no new cases of COVID-19 in our province, and the total number of cases remains at 1,384. There have been no new recoveries since yesterday, leaving 13 active cases in the province. No one is in hospital as a result of COVID-19, and a total of 157,959 people have been tested to date. The Atlantic bubble officially reopened as of 12:01 a.m. this morning for residents of Atlantic Canada, and we remain on track to lift the travel restrictions next Thursday, July 1st. As of Monday, approximately 76% of our eligible population has had at least one dose of a COVID-19 vaccine. We have therefore surpassed the 75% criteria we established for reopening. Nationally, the epidemiology continues to trend in the right direction, with just over 600 new cases reported in the country yesterday. Provincially, we have had only 2 cases reported in the past week, and all indicators signal that we will be able to move to step 1 on July 1st. Our new travel form will go live Monday, June 28th. Anyone coming to the province on July 1st or later will need to complete the new form and may do so up to 72 hours in advance of travel. Everyone over the age of 12 will need their own travel form to declare if they are fully, partially, or unvaccinated. The form will allow each traveler to upload proof of their vaccine. Anyone partially vaccinated can also upload a negative COVID test result taken within 72 hours of departure, and this can be any molecular COVID-19 test, but an antigen test is not acceptable. As long as all individuals aged 12 or older in a traveling party have had at least one dose of vaccine, all travelers can follow the self-isolating and testing requirements applicable to their own individual vaccination status. Children under 12 follow the parent or guardian vaccination status. However, anyone traveling with an unvaccinated individual aged 12 or older and sharing accommodation such as a home or hotel room with that individual must self-isolate for 14 days regardless of vaccination status. If you have or will arrive in the province between June 18th and the 30th, you can transition to the new rules on July 1st by completing the new travel form and uploading your proof of vaccination. Anyone fully vaccinated can leave self-isolation immediately on July 1st without any testing requirements after completing the form. Anyone partially vaccinated should book a COVID-19 test as early as July 1st, and once they receive a negative result, they can leave self-isolation. There will be more information on our website in the coming days to help travelers plan their travel to Newfoundland and Labrador. While our first dose vaccination rates continue to rise, we expect to see significant increases in the rate of second doses in the weeks ahead. Over 10% of our eligible population has already had 2 doses. I know there has been some confusion and frustration regarding booking second dose appointments, and we ask you to bear with us as new time slots are added continually. All second dose appointments were canceled because we can now offer everyone their second dose much sooner, and in many cases almost 2 months sooner. The faster we can deliver second doses, the better protected we will all be. One dose of a vaccine offers good protection against COVID-19 and its variants, but the second dose offers much better protection. And as travel opens and restrictions start to ease, both provincially and nationally, it is critical to get as many people as we can fully immunized. This is our best defense against another COVID wave. In booking a new second dose appointment, there are some things to keep in mind. You will not be left behind. There will be an appointment for you, even if you do not see any openings right now. Check back periodically on your Regional Health Authority website or contact your pharmacy or physician to book your Moderna vaccine. We are adding new clinic locations, so you may need to check for appointments in multiple sites. As an example, clinics are now being held at the Glacier in Mount Pearl. Family members may need to book different appointment times. It is not possible to book group appointments, and it may be difficult to get 2 or more appointments at the same place, and time. Do not delay booking your appointment just to find a time slot together. My family has been to the vaccination clinic 5 different times. Please do not book multiple appointments. If you need to change your appointment, please cancel your other appointment immediately so that someone else can book that time slot. Remember to book your second dose at least 8 weeks after your first. This dosing interval was established based on evidence regarding immune response, as well as our anticipated vaccine supply and public health capacity. When you arrive for your appointment, you may be offered a different vaccine product than received for your first dose. The mRNA vaccines, Pfizer and Moderna, are interchangeable. Receiving a different vaccine for your second dose is safe and effective. The National Advisory Committee on Immunization recommends that when the same mRNA vaccine product is not readily available for the second dose, another mRNA vaccine can be considered interchangeable and should be offered. Readily available means easily available at the time of vaccination without delay or vaccine wastage. The most important thing is to get your second dose as soon as possible. Do not delay receiving your second dose just to get the same vaccine you received for your first dose. Please take the vaccine that you are offered. The quicker that we can get everyone fully vaccinated, the quicker we can get back to normal. I would like to confirm that public health officials in Western Health are investigating a possible case of myocarditis after COVID-19 mRNA vaccination. This has occurred in a female between 20 and 39 years of age. And while there have been reports of myocarditis and pericarditis after vaccination, both across Canada and elsewhere in the world, to date, no clear association has been established between this condition and the vaccines. There have been a small number of reports in Canada, but we are not seeing higher rates than would be expected based on the background rates for these conditions. We continue to monitor myocarditis and pericarditis closely through our vaccine safety surveillance systems, and will update as more information becomes available. I would like to reiterate that these vaccines are extremely safe and effective. Adverse events following immunization are monitored closely, and to date in Canada, adverse events have been associated with just 0.026% of all doses of COVID vaccine administered in the country. As a recap, for anyone just joining us, there are no new cases of COVID-19 in our province, and the total case count is still 1,384. Despite the logistical challenges in booking second dose appointments, we are hearing loud and clear that there is a strong desire by Newfoundlanders and Labradorians to be vaccinated. This is so encouraging, and I thank everyone who has made the choice to get the shot and do their part. For anyone who has not booked a first dose, it is never too late. Please book an appointment. There is a dose waiting for you. As we prepare to lift the travel restrictions and welcome travelers back into our province, please be kind and have patience with each other and hold fast Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now ask Minister Haggie to provide some brief remarks.
Thank you very much, Premier. Just really to pick up on a couple of things that Dr. Fitzgerald has said, perhaps for emphasis. Zeros across the board. We have nobody in intensive care, nobody in hospital, and no new cases. Those are very encouraging. In terms of the vaccine supply, we have had a significant increase in the supply of Moderna and expect this to continue into July. So simply in the terms of numbers available, we are going to have 3-to-1 ratio of doses in favour of Moderna on any given day, and that is part of the predominance of Moderna in our discussions at the moment. But as Dr. Fitzgerald, Public Health Agency of Canada, CBC with Dr. Lynn this morning explained very clearly, these are safe and interchangeable and provide the protection that we need to move forward. The Atlantic bubble, as the Premier referenced, is open. There is a new form for travellers from Atlantic Canada. It's not an exemption process. It is merely a documentation process that went live at midnight last night. In terms of travellers leaving the province, from Monday, we will have a web-based mechanism for people to access their own vaccine record to view or print or upload, and this will require a valid MCP card. There will be guidance on the website later on in the week, and the process will be essentially very similar to how you would normally pick up your COVID test result, for example. The only other comment I would make for people leaving the province anywhere in Canada or indeed abroad is an old regular plea from the Department of Health that people should look at making sure they have adequate travel insurance. There are services that will want to require medical help in this province would be covered, but out of province they are not, and they are your responsibility to cover either directly or to have insurance to do that for you. It's a lot cheaper to go the insurance route, and it's a source of perennial difficulties for people from time to time over the course of the travelling season. So with that, continue with public health measures. The masks and the distancing stay for some time yet. Exactly how long that will be depends on advice from Dr. Fitzgerald, but we are doing very well, and we just need to maintain the line, hold fast, as Dr. Fitzgerald would say. Thank you, Premier.
Thank you, Minister. I'll now invite questions from the media in person and virtually.
Thank you, Premier. For the benefit of our speakers, we have 4 media in person and 1 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Thanks, Leslie. Dr. Fitzgerald, what do you say to people who, in looking to book their second dose, were really looking to follow what they'd gotten for their first? They're afraid that when they travel, that it's not going to be recognized if they've got 2 different vaccines.
So, based on the information that we have and what the National Advisory Committee on Immunization recommends, we do consider these interchangeable. And at this point, the most important thing is to get two vaccines, 2 doses of an effective vaccine. So, to the best of my knowledge, at this point, it should not affect travel. But I'm sure more information will become available on that as time goes on. But the antigen that is produced by these vaccines is essentially identical. There may be a few very small differences, but essentially identical. So we would expect that the immune response that you would get would be just as good with Moderna as it would be with Pfizer. So whether Pfizer is followed by Moderna or Moderna is followed by Pfizer, we don't anticipate that there would be any difference between the 2, and we would recommend that you get your second dose, whichever one is offered.
Thank you. And in regards to looking to book your vaccinations right now, in doing so between pharmacy and online, the push for the second doses has been increased drastically here, looking to get it at that 8-week mark. But overall, when we're doing that, is it a race right now between the Delta variant and vaccine to be fully vaccinated? Is that where this big push is coming from?
Yeah, so what we know so far about the Delta variant, and of course information is coming in all the time, as it has been since the beginning of the pandemic, really, is that 1 dose of these vaccines, or the Delta variant, does not seem to be controlled in quite the same way by 1 dose as with 2. So we want to make sure that we're preventing any outbreaks of the Delta, any waves from the Delta variant, and so having 2 vaccines is the most important thing to be able to reduce that. So the quicker we can get that done, the better we'll be, I think, especially as larger provinces start to open up.
Also a balance of supply as well.
Yes,
we're
absolutely.
able to kind of move to this position.
Yes, yeah. I mean, when we started this, we didn't know how much vaccine we were going to be getting and exactly when. And now, we have a huge upsurge in supply with Moderna.
Our next questions are from Peter Jackson with The Telegram. Please go ahead and make your way to the mic.
Good afternoon. This is probably for the Minister. When I rebooked my vaccine, the system that was used would automatically cancel my second dose. Why wasn't that continued? Why didn't you continue using that function?
Thanks very much, Peter. Nice to see you in the flesh, as it were. Always a step in the right direction. With regards to the operationalisation of the swap, as it were, between the old appointment and the new one, that was really a technical issue as much as anything else with the software. There were a significant number of appointments in the system, and it was less labour intensive and more straightforward simply to cancel en masse when we knew that we would have vaccine supply. The challenge I think people have seen is that we are, as they say, painting new clinics out based on what we know of vaccine delivery. Given the schedules from Pfizer and the schedules from Moderna, we only do it when we have confirmed numbers. By and large, that isn't a period greater than 6 weeks. So as was referenced earlier on, we could find out later on this week of confirmation of supply, for example, in the last week of July, which would enable several dozen new clinics to be painted. It was simply an operational issue that was felt to work better by the software people.
Thank you. And for Dr. Fitzgerald, are you surprised at how dramatically cases have dropped off here? It seems like only a couple of weeks ago we were getting a few dozen a week, and now we're basically getting nothing.
Vaccines.
So I think, I'm not surprised. We did expect this to happen. We expected that we would see more cases as numbers were high in the rest of the country. Seeing what's happened in Alberta and Ontario, I mean, Alberta's numbers have plummeted, and as has, Ontario's have steadily come down, Quebec's have steadily come down. Everybody is doing quite well right now, and so our main source of new cases is travel. And so as we see a reduction in cases elsewhere in the country, we're going to see a reduction in cases here. And that's partly because of vaccines and partly because of measures that have been put in place. And certainly those measures in other larger provinces got put in place, allowed the vaccines time, or the provinces time to get their vaccines rolled out, get one dose into people. And so I think we're seeing a combination of that, of those public health measures and the vaccine rollouts really making a difference.
Our next questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
A question, Dr. Fitzgerald, about the Atlantic bubble. We've seen Nova Scotia having concerns about people from New Brunswick being able to come in without quarantine, so last minute they brought in measures because New Brunswick has opened to the rest of Canada. Do you share any concerns about allowing New Brunswickers to be able to come into the province without facing any sort of isolation or testing?
So at the moment, we don't see the need to have any isolation or testing for New Brunswickers. Certainly in New Brunswick, they do have good vaccination rates. Their case rates are low. Their epidemiology is quite favorable, very similar to ours. So at the moment, we don't see that need to do that. It's a very similar situation to what we had last summer. And we will monitor the situation very closely. If we start to see an increase in cases in New Brunswick, then we will have to rethink things, I think. But, at the moment, I think we're good to go on as we had planned.
And I want to ask about the mixing and matching of the two mRNA vaccines, because this is a topic that I think has created a lot of anxiety for people who may have booked a shot of Pfizer because they got Pfizer in the first case, and now they're being told you might get Moderna instead. If you've said that the evidence shows these are essentially interchangeable. If you look at CDC guidance, they looked at the evidence and said it should only be in exceptional circumstances. You should do everything you can to absolutely try and get the same dose that you got in the first time. So why are we taking a very sort of much looser approach when it comes to mixing and matching than other places?
So NACI, the National Advisory Committee on Immunization, they certainly do look at evidence. They look at vaccine science. They look at what they have criteria for what they would consider interchangeable vaccines, and we certainly interchange vaccines in our vaccine programs. Not uncommonly. You may start with one type of an MMR vaccine and finish out your series with a different type of an MMR vaccine. That happens quite commonly in a lot of vaccine programs. And so when we look at what's required for a vaccine to be interchangeable. So they have to be approved for the same purpose, which these are. They have to produce similar antigens, which these do. They have to have very similar immunogenicity and side effect profiles, which these do. So, you know, we certainly are seeing that the evidence that we have and the science that backs up our decision making certainly tells us that these are interchangeable, and I think as time goes on, we'll certainly see that borne out in the evidence.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead and make your way to the mic.
Thank you. Now that Newfoundland and Labrador has reached more than 76% vaccination rate, is it possible the dates for a reopening plan, so steps 1 through 3, could be moved up?
No, we're going to continue with the dates as they are. It was contingent on hitting, the chronology was contingent on the rates, but the rates are consistent now, so the chronology should maintain.
Thanks. And what is our province's PPE and testing capacity like right now? And does it need to be increased to coincide with increased travel into the province?
That's a good question. We average around 900 COVID tests a day through the laboratory at the moment. The capacity of our public health laboratory without going kind of overboard is around 6,500 to 7,000 a day. So we have plenty of slack there. In terms of PPE, we've actually achieved an inventory of 90 days at pandemic rate for all commonly used PPE. For example, if you look at level 2 gowns, which are standard use for healthcare providers, we have slightly over 4 million of those in stock as of beginning of this week. So we feel we're well equipped there. Supply chains are now more nimble than they were back in the first wave when there was a kind of global scrabble. So we're not envisaging any problem with PPE or testing capacity or indeed testing supplies. We have sufficient of those.
We will now go to the phone. Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. I also want to ask about the mixing of vaccines. I've heard from a lot of people who have raised ethical concerns about doing that. Most of the people I've heard from have said that it's fine if people want to mix their vaccines, but it should come down to personal choice. And they say that it's not acceptable to find out when you get to the clinic what vaccine you'll be getting. So Dr. Fitzgerald or Minister Haggie, whoever wants to respond, from an ethics point of view, how do you respond to those concerns from people?
It's a good question, and it's like most ethical questions, somewhat nuanced. Essentially, we have offered what we believe to be a safe, justifiable, and rational approach to vaccination. In terms of the mechanics, if somebody goes to a clinic and finds that they are being offered a vaccine that they would prefer not to have, they are perfectly at liberty to make alternative arrangements and book again. The process of changing an appointment could be as simple as going back online and doing so. There is a capability in the booking system for you to do that and make subsequent appointments. From an ethics point of view, I think Dr. Fitzgerald has made the case quite clearly that these are interchangeable. As one public health nurse said to me when we were discussing this, when I had my first shot, she said, you know, who asks who makes their MMR or their flu shot? These two things do the same job. So that's our approach. And, as time goes by, the proportion of Pfizer may increase. And that choice may be a little bit easier, but this is the situation we're in at the moment, and I think it's reasonable, and I think it's justifiable.
Thank you. And I had a question about that case of myocarditis that's being investigated on the West Coast. How long after vaccination did this woman first develop symptoms of myocarditis, and what exactly is involved in the investigation process moving forward?
So I can't speak to specifics about a person's medical case. I will say that, the evidence from around in the United States, in Israel, and what we're seeing here in Canada up to this point, the majority of people who get symptoms do so within 2 to 3 days after getting the vaccine, whether it's their first or second shot. So with regard to the investigation, I assume you mean the public health investigation as to whether or not the two are connected, because I can't comment on cardiology investigations.
We don't have that covered, no.
No cardiologist.
Definitely not. With regard to public health, the medical officer of health will, somebody fills out what we call an AFI form, or an adverse events after or following immunizations, and that form comes into the public health office. It gets reviewed. The medical officer of health will review it. They will do their investigation, ask questions, perhaps discuss that with the attending physician, and then they'll make their recommendations based on the information that they get and test results, and if another cause potentially could be found for the symptoms, then it may not be deemed to be related to the vaccine. So, and as of right now, we have to remember that we haven't really established a causal link here between the vaccine and this condition, and it is somewhat more common than other conditions that we have seen, such as VIT, and so. The rates that we're seeing in the general population are higher actually than what we're seeing in the vaccinated population. So we can't really jump to say that there is a causation here. There's just an association, a signal. But of course, as with any new vaccine, we take that very seriously, we monitor it very closely, and investigate as need be. So as we have more information, we'll certainly make that available.
Thank you.
I will now go back to each reporter to see if you have one final question. Kellyanne Roberts with NTV, do you have a final question?
Yes, thank you, Leslie. Hearing from some people about a list that they're on in regards with Eastern Health, and I know that's a separate entity, but they're under understanding that they will be scheduled for a special vaccination clinic, those that are at high risk of an allergic reaction that'll likely be attached to a hospital setting. Just wondering where we're at with that process, and if for people who aren't aware of it, how they potentially could get on that list.
Thanks very much, Kellyanne. Yes, there is a list of patients or clients who are deemed or have been discovered to be high risk, probably had allergic reactions to previous vaccine components. Those people will have a mechanism, if they haven't already done so, through local public health. We have discussed actually today about issuing a PSA with some specific contact information for each regional health authority, because we've heard some concerns that people felt they were missed out or not on these lists. So look for that over the next day or so. But these will be clinics held more than likely in an RHA facility to address the allergic reaction concerns of the individuals. But those have happened and will continue to happen. We're just going to smooth out the mechanism and make it better known.
Thank you. Peter Jackson with the Telegram, do you have a final question?
Yes. I'm wondering about the ever-diminishing star quality of AstraZeneca. Is that actually still going to be available since it isn't in an mRNA, so people may be a little more concerned?
Yes, so certainly, the NACI recommendations just recently came out and said that they would recommend an mRNA after AstraZeneca, just because of it seemed to give a better immune response, as well as the concerns with regard to VIT. So that is a recommendation. However, that being said, there is still the option to receive AstraZeneca as your second dose, if that's what you choose. And certainly, if there are people who have allergies to components of the mRNA vaccines, we would certainly recommend AstraZeneca in that situation, as opposed to no vaccine at all.
Peter Cowan with CBC, do you have a final question?
I do, and that's about the 8-week interval that we're recommending right now. In fact, you can't get your second dose less than 8 weeks. We've seen other provinces move to a shorter time period than that, and we know the federal government has said by the end of July there will be enough vaccine doses available that everyone will be able to get their second shot. So are we looking at reducing that time frame?
So at the moment, we're continuing with 8 weeks. As with everything, we're looking at, we're continually reevaluating and deciding what we need to do. The 8 weeks was looked at as, as we got more supply, to shorten the time period. But there's some evidence that says, perhaps a longer time between your two vaccines might actually improve your immune response. And we might see, there's some thought that we may see a longer immune response if we have some space between the vaccines. I certainly can't speak to why other jurisdictions make the decisions that they do, obviously. But when you look at the epidemiology in some other places, obviously getting 2 doses of a vaccine in so that it's more effective against the Delta variant in particular would be important. So I certainly can appreciate why some jurisdictions would want to get that second dose done faster. We thankfully are in an enviable position where that epidemiology is not ours. So if we maybe can improve the immune response, then we'd like to do that.
Thank you.
Elizabeth Witten with All Newfoundland Labrador. Do you have a final question?
Yes, I do. Step 3 requires at least 80% of our eligible population be fully vaccinated. But I'd like to know, what is the ideal vaccination rate in the province?
100%.
100%.
Ideally, yeah, 100%.
Yeah.
Like, some people are going to be too young, like if you're under 12. Some people, for like medical reasons, they're not going to be able to get any vaccine.
Yeah.
So assumptions built in.
Yeah.
Way back, yeah.
Yeah, so we certainly, we would like to see 80% of the eligible population, which is what we've said. So that's going to translate into slightly less than 80% of the total population, obviously. So ideally, what we would like to see is at least 80% of the total population be vaccinated once these vaccines are approved for younger people. And, that would be the ideal situation. But, that's the ideal for flu as well. So just putting a plug in there for that.
I think it's a good question, but I think it's worth reinforcing that the denominator that we use for the percentage calculation is actually eligible people. So it's the population of this province, 12 and older. So when we talk about 76% with dose 1, it's 76% of that number. Because 0 to 11 are not eligible, they're not included in that denominator number. If the vaccine licensing changes, then obviously the percentage would change, but the ideal would be 100% of the entire population vaccinated.
Richard Duggan with VOCN. Do you have a final question?
I do. Dr. Haggie, earlier you said as of Monday people can access their vaccine information online, and I had someone reach out to me wondering what is included in that documentation so that they can prove authenticity in other jurisdictions. So if someone from here goes elsewhere in the country, how do people in that jurisdiction know that the document is legit?
That's a really interesting question. We have, as yet, no national or federal agreement on what constitutes a validated certificate of vaccination. This is simply a copy, a printout of the electronic health record of your vaccination. So if you've had 1 dose of Pfizer and 1 dose of Moderna, it will show that on there. If you've had 2, it will show that too. The issue of validation of documentation is very much a kind of live issue at the federal and health ministers' table, and as yet no one has settled on a satisfactory universally approved answer, shall we say. We do have documentation that is issued for travel for other vaccines, yellow fever and these kind of things, and it's simply a signed document. It's not embossed or franked or done in any necessarily specific way. So that's new ground for us, and we'll follow national guidance. But this is designed for ease. It will provide, information like lot numbers and dates of administration, and for any Canadian jurisdiction, we all have access to that. So if we want to audit a document to see if it's inauthentic, if the vaccine numbers and the dates and the jurisdiction don't match, we'll know it's fake. But other than that, it's simply a record.
Thanks.
Thank you, everyone. Premier, do you have any final comments for today?
Thank you all for joining us, especially to those in person for the first time in quite some time. This is yet another sign that things are returning to normal slowly and responsibly, but we will get there. Another good day today as the Atlantic bubble opens and zero new cases, there's no one in hospital. It's a good day. So we look forward to chatting again next week. Stay safe, Newfoundland and Labrador.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.
Hospital. By the time I got to the hospital, I was completely holding. This arm was completely immobile. I couldn't.
It was just like limp,
flop.
just
I couldn't push. It was pretty much my right side because I couldn't even shuffle up on the stretcher or anything. I couldn't move. I could. Everything on this side was kind of falling over, and so the doctor knew right away what was going on, and so he was getting the TPA, this drug that can reverse it. I don't know.
TPA?
Yeah,
that's the name of the drug.
Yeah.
Okay.
And it's a mixture. It's a mixture of drugs. So they started mixing that together and getting that ready for me. But then right in front of the doctor, my arm came back again, and he said.